Hi everybody, my name's Jade and I'm a community engagement worker on the Answer Cancer programme.
And my name's Anthony Whittaker. I'm the Cancer Screening Improvement Lead for the Bolton Bowel Cancer Screening Programme.
And I've been speaking with Anthony to help raise awareness of bowel cancer screening and the importance of early detection. And we've put together a few short videos just to address some common barriers that we've come across sometimes that might prevent people or make people feel like they don't want to take part in the bowel cancer screening. So we know that people are very busy, people lead busy lives, and that they've got conflicting priorities, and sometimes life just gets in the way of things. But Anthony, what would you say to people who think that the bowel cancer screening and completing the home testing kit isn't a priority to them? Why should they make it a priority?
Well, I'd say first that I understand that absolutely we do lead busy lives, and I think we often prioritise our to-do list with things that are affecting us right now, whether it's issues with money or jobs or plans for the weekend. So as we've mentioned already, that screening is for people without symptoms. So it's important to know that just because we can't feel anything wrong in the bowel doesn't mean that something needs checking out right now. So it could be that what's going on in your bowel actually getting screened is a massive priority right now, and we just don't know about it.
Oh, that's brilliant. Thank you. And with the test, with the fit kit being something you complete at home and you're having to take a sample of your own poo, we often think here that people think it's going to be quite a messy experience, and people are often quite embarrassed as well about speaking about that and maybe about even doing it. So kind of what advice would you have around that? And is it messy? Like, just to be honest about that.
Sure, yeah. It's well, in context, the screening kit changed in 2019. Where you had to take 3 samples of your poo, you had to store it, and then you had to send it off after your third sample. So you'd be keeping hold of it for days, maybe longer. So that put people off. But now we have the fit kit, which means you just have to take 1 sample and you can send it away in the post as soon as you've done it. So it's more straightforward. It is more accurate. And it's shown to have a positive impact on the amount of people doing it, which is really good. We'll put a link in the comment section of a video on how to complete your kit, and this is available as well through the link in I think about 10-11 different languages as well. So if you don't have the internet, you can ring the Bowel Screening free phone helpline for some more information of how to complete it. That's 0800 707 6060. But I guess, yeah, it's perfectly normal to feel embarrassed about completing a screening kit. Most of us have never taken a poo sample before, so it's going to seem completely unnatural to do that. There was over 5 million people in 2019 who took a poo sample, so you're not on your own in doing that. Plenty of people are doing it. You might find as well that once you've done your first one, then it's not as much a big deal as what you might think it is before you've done that. If you do the kit and have an abnormal result, and you go on to see one of our nurses, all our staff at the programme are really well trained and qualified to support you through your journey. And I mean, the nurses have heard and seen it all before. So what you might find embarrassing to talk about, it's as everyday talk as asking for a cup of tea for these nurses. So it's not something that they'll be embarrassed about either.
Oh, fab, thank you. And I think we see that as well in our other videos when we've spoken to Suzanne. She's very easy to talk to, really laid back about it, just because it's part of her everyday life, isn't it? So thank you. Obviously, cancer is a hugely scary topic, and the idea of being told that you might have cancer could be quite devastating and traumatic for people. What would you say to people that just don't want to know if they've got cancer, they just don't want to find out if they've got that diagnosis?
Yeah, it's definitely the news that nobody wants to hear. I mean, what I'll reiterate the point again, that this is the person's choice whether to take part in screening. So if someone has looked at all the information and said this isn't for me, that's absolutely down to them. Nobody's going to pressure them. But the reality is that if there is going to be a cancer in somebody's bowel, or a polyp that's in danger of turning into a cancer, then you will get that news at some point that you've got it. whether it's when you start getting signs and symptoms that we've talked about down the line, and it may have developed or spread, or it's if you go through bowel cancer screening earlier. The fact is that the earlier we know about the cancers or the polyps that may be dangerous, the easier it is to treat. So 9 out of 10 cancers can be cured when diagnosed at the earliest stage, which is massively important. And the longer it's left without treatment, the slimmer the chances of survival become. So that's why screening, it does essentially save lives.
Yeah, definitely. Thank you. And I guess just going back to it being someone's choice and making sure that people make a fully informed choice around if they take part in cancer screening. I guess that comes around knowledge, doesn't it, and having that accurate information. So do you think there's sometimes cases where people don't know what the test is for and don't know why they've got it in the post? If that's the case, how can they find out why they've received it?
Yeah, I guess when you take part in something, it's important that you understand what it is, what the risks are, what the benefits are, and what the potential outcomes are before you even take part. That's really important. But when you're invited, once you get your letter through the post, there's a booklet in there and it's got absolutely everything in it. So it's in case of going through that with a fine-tooth comb, understanding what you might be getting yourself into, or making that decision not to take part. But there's plenty of different channels of support as well. If it's easy to watch a video, maybe if that's your preferred learning way. So you can look on the NHS website. We'll put some links on, or the videos we've mentioned already that we've talked about. But again, if you don't have the internet, you can ring the free phone helpline on the number we've mentioned. We'll pop that in the comments as well.
That's great, thank you. And then just talking about maybe someone who has an abnormal result, they will be invited then, won't they, to talk about the next steps, like with a nurse around what would be the next steps of ruling out a cancer diagnosis or finding out what else is going on. If someone was invited to attend a colonoscopy and they had some fears around that, what advice would you give them to somebody who felt they were quite fearful of taking part in that process?
It can be a fearful thought for a lot of people going with that ahead of them. I would say that patients' experiences of colonoscopy can be different, so try not to base it on somebody else's experience. In terms of the feedback, so a part of my job is to report on patients' experience of their journeys. So they'll fill a questionnaire and I'll put it all together and see what's good, what we can build on. And generally, the feedback we get is it's more of a discomfort than a pain. I'm not saying it won't be painful, but that's what most people say. It's more of a discomfort. So there are pain relief treatments available that you can discuss with your specialist nurse beforehand. But again, in terms of the feedback that people give, it's often that the worst part of the whole pathway is taking the laxative drink before the procedure, as opposed to the colonoscopy itself. So again, if it comes back abnormal, then you'll have an appointment with your specialist nurse who will give you all the answers you need for your questions for colonoscopy.
Oh, fab, thank you. And we have spoken with Suzanne as well, who's a specialist screening practitioner, and she kind of goes into a bit more detail about the colonoscopy and the other options available, and so that's definitely worth checking out, isn't it, to see what Suzanne says, and also meet someone who's responsible for doing that, and you can see how friendly they are and how supportive she is as well. So thank you everybody for listening to this video today, and like we said, we've got a few more videos on our social media talking about the bowel cancer screening process, and also some of the barriers that we're addressing with Anthony today, so please go and have a look at those as well.